I have normal testosterone levels. Can I still be on testosterone replacement therapy? So the short answer is yes. You can be on anything, no matter what your levels of anything are, right? The real question is it medically appropriate to be on testosterone if you have quote unquote normal testosterone levels? That's a different question. The answer to that question is it depends. Okay? And what does it depend on? Well, to put it very simply, the people that should be on testosterone are the people that are going to be reasonably expected to benefit from testosterone without undue long-term risk to their health. The people that should not be on testosterone therapy are the people who are not going to be reasonably expected to benefit, or the long-term risks outweigh the potential benefits. Okay, so let me give an example of both. So let's say, first scenario, you're a man with so-called normal testosterone levels and you are severely overweight. Your body composition scan, whether it's a DEXA scan, whether it's an in-body scan, shows you have a high amount of visceral fat, meaning fat that surrounds your internal organs. Let's say you have low skeletal muscle mass. Okay. All of those things have been shown in multiple research trials at this point. Those can be improved with testosterone therapy. Okay? All of those things can be improved with testosterone therapy. Not only that, if you are a man who meets that criteria, and let's say you go on one of these new weight loss drugs, Ozempic, Mounjaro, whatever the case. Yes, those drugs are good at promoting fat loss in men who are able to get to the target dose and stay on it for at least, it's a little bit more than a year, a little bit less than 2 years. All right? Those men will lose fat. The problem is, without any extra hormonal help in the form of testosterone, they will very likely lose a lot of muscle mass in addition to a lot of fat mass. That's very bad. Why is that very bad? It's very bad because if you lose a lot of fat and you lose a lot of muscle at the same time, you increase the risk that you're going to regain that weight once you stop treatment, okay? The second reason is we know from multiple studies that one of the biggest long-term predictors of longevity is your skeletal muscle mass and especially your muscle strength. The reason why a man with so-called normal levels who's on, weight loss drugs or even just low-calorie diet for a long period of time, why would that man be on testosterone? Simply because it will improve his skeletal muscle mass, accelerate fat loss, and most importantly, not only improve, but preserve muscle mass as he's on his fat loss journey. That will make him much more likely to be successful in the long term at maintaining the weight loss and probably improve his long-term health outcomes, reduce risk of chronic disease, reduce risk of cancer, slow the aging process, etc. There's not a lot of direct evidence for that, but it's extrapolated evidence from the way that we know that testosterone works, okay? So the short answer is, in a man who fits that scenario, it can definitely be appropriate to be on testosterone. In that case, it would be for body recomposition purposes, okay? And are there studies that show that even in those men who are overweight, normal testosterone levels, does testosterone help them? Absolutely there are, okay? Absolutely there are. It's unequivocal that testosterone therapy, when dosed appropriately and by an expert who knows what they're doing, testosterone can help that situation long term. And in terms of the long-term risks, though, in that particular person with so-called normal levels, we know nothing about the long-term risks. Those studies have never been done. Most of the risk studies with testosterone have been done on men with hypogonadism who meet the criteria of having low testosterone levels at the outset of treatment. So for anybody with so-called normal levels who goes on testosterone, the long-term risks are essentially totally unknown. But you have to balance the unknown risks with the very well-known risks of having obesity, especially a lot of visceral fat, especially a lot of, or a low amount of muscle mass and muscle strength. Long-term, those things are very bad. So unknown risks of testosterone long-term versus very well-known high risks of chronic disease, early death from having low muscle mass, high fat mass, especially visceral fat mass. Okay, so that's one example of a patient that potentially should be on testosterone even with so-called normal levels. Okay, and that's not to say that every overweight man has to be on testosterone. I'm not saying that, but there are some people that fit that category that are absolutely appropriate for testosterone therapy, and I don't care what any other doctors say. They're wrong. That their opinion is not based on evidence, it's based on dogma. Okay? Now, going to the second example, a man with normal testosterone levels who should not be on treatment. Okay. If you're a man who comes into one of these TRT clinics, you say, I want to be on testosterone. Let's say your levels are 400, 350, whatever. They're borderline, but they're not low. And let's say the only symptom that you have, your body composition is within normal ranges, you don't really have mood symptoms, you don't really have fatigue. Let's say your only symptom is erectile dysfunction. Usually that's not the only symptom, but just for the purposes of illustration. Well, we have plenty of studies to show that just testosterone therapy in men who have so-called normal levels is not going to improve erectile function if you have normal levels. It takes your levels being very low to actually start affecting erectile function. So if that's your only symptom, you probably shouldn't be on testosterone therapy because you can't be reasonably expected to benefit from testosterone therapy, right? So I guess what I'm saying is the goal of testosterone is different for every patient. Every patient has to be looked at individually, and the risks, benefits have to be carefully weighed and balanced. You know, you're talking about a guy in his late 40s, early 50s with diabetes and massive amounts of abdominal and visceral adiposity and low skeletal muscle mass. That's a person, just weight loss and dieting programs is not going to work. The studies show that it's very unlikely that that alone will work. That's a patient who definitely should be considered for testosterone therapy, and not all of them are going to be appropriate for it for whatever reason. Maybe some of them have prostate cancer, maybe some of them don't like the unknown long-term risk of testosterone. Okay, so not everybody in that category should be on testosterone, but what I'm saying is everybody in that category should be considered for testosterone. And what you do as an expert is you take each person individually and assess the possible benefits, which would be, does testosterone address the signs and symptoms in this person? Can it be reasonably expected to improve their situation? And you weigh that against the long-term risk, which, as I said, mostly largely unknown. Okay, another point which you're not going to hear from the vast majority of other doctors, even TRT clinics. Because the goal of testosterone therapy is different in every person, it is not, strictly speaking, related in some cases in any way to the testosterone level that they achieve while they're on therapy, right? So let's say you're a guy who we're trying to do body recomposition on. You're on weight loss drugs, you're on an intensive diet and resistance training program, and you're on testosterone. And before you started testosterone, your levels were normal. Are we just going to say, oh, we got you to 800 or 900 or 1,000 or whatever, we're good. That's the end of whatever dose you need? The answer is, it should be obvious that that's not the target. It should be obvious that if we're putting you on testosterone for body recomposition purposes, then what we need to look at is your body composition over time, not your testosterone levels over time. You may require a lot of testosterone to achieve the body recomposition goals that we set for you at the outset. That should be obvious, but apparently it's not obvious. Everybody wants to look at their labs. Everybody wants to have a specific target. Everybody wants to keep their estradiol under a certain amount. Everybody wants it. All that stuff is bullshit. All that stuff is not research-based. It's not evidence-based. It ignores what the use of testosterone in that particular person is. Now, yeah, if you're someone with hypogonadism and you have hardly any symptoms, okay, we'll target you to the middle of the normal range. If you don't like long-term risks, or you don't want to take on the unknown long-term risks of being any higher than that, and you only want to go off the safety evidence that we have, the best trial, latest trial is something called the Traverse trial, okay? We know it's reasonably safe to put you on testosterone and get you to a certain level, okay, if we're going to be obsessive about levels. But in the majority of patients that are appropriately put on testosterone, even if they have so-called normal levels, the end goal is not a specific testosterone level. Let me say that again, because a lot of you are going to have trouble with that. You're not going to accept that. That's not what you heard. That's not what you read. That's not what someone told you. But I'm going to say it again because what I'm saying is true. It's based on just logic and common sense. If you're on testosterone for body recomposition purposes, we're not targeting a specific testosterone level. We're targeting your body composition. That's not to say we just give you skyrocketing doses of testosterone. I'm not saying that at all. But what I'm saying is, let an expert be the one who tells you what dose you need. But make sure that if they are calling themselves an expert, they're actually looking at your body composition over time. Because if they're not looking at your body composition, they're ignoring one of the main mechanisms by which testosterone improves long-term health. If you're on testosterone and your body composition is not changing, you're not being dosed appropriately. It's just that simple. So just to conclude, can you be on testosterone if you have normal pre-treatment testosterone levels? The answer is yes. But what that means is that your treatment target is going to be based on the reason that we put you on testosterone treatment in the first place, which may have nothing to do with your testosterone lab tests. Okay? Now, we may titrate things based on how high your hemoglobin and hematocrit gets or what happens with your lipids, and there's a variety of other things that we would consider and we would monitor. But strictly speaking, it's not Joe started at a level of 450, so we get him to 1,200. And once he gets to 1,200, we're done, and we don't give a shit about anything else. If that's what the vast majority of TRT clinics do. Okay, so I guess the other point is you need to have an expert do this. Most people working in TRT clinics are flat out not experts. In fact, a lot of them have no idea what they're doing. They're just following algorithms. Okay, TRT is a billion-dollar industry in this country that's growing every year, and it's attracted a lot of unscrupulous, inexperienced, non-expert, mostly in many cases non-physicians, which I'm not saying that all nurse practitioners and PAs are bad. There's some that are excellent, don't get me wrong. But you do need an expert, okay? And so, yes, we're going to target in people with normal pre-treatment levels. We're going to target whatever end goal we have that may not be related to their testosterone levels. And at the same time, we're going to have extensive discussions with that patient. Listen, we don't know the long-term risks. They're largely unknown. We know the long-term risks of, being super obese, having, a lot of visceral fat, having low skeletal muscle mass, having low bone density. We know all those things to a reasonable degree. Okay? Can we improve your specific situation? And also equally important, are you okay with the unknown long-term risk that this treatment carries? That's a decision for you to make. That's not a decision for your doctor to make unilaterally. Okay, even though a lot of people do that, that's called shared decision making. That should be a decision that you make with your doctor. If you say, I want to feel better, I don't want to live like how I'm living, and potentially testosterone can help with the things that bother you, then you may be appropriate for therapy, but please don't get it in your head then that we're just going to get you to a certain level and just be done with it. It has to be based on what the reason you're on it for is in the first place. And that should be obvious, but like I said, for some reason, it's not obvious.